Okay.
All right, I'm really looking forward to sitting down with both of you today to talk a little bit about the SharpIndex Awards and about the good news in healthcare, like what people are doing to help with mental health. So I'd love if you introduce yourself and talk a little bit about your work.
So I'm Ayman, and I'm the founder of Jivika. Jivika teaches mindfulness through micro habits to reduce frontline burnout. And we work with over 31 healthcare organizations, and including Cleveland Clinic, Rush Medical. And we have seen in some of the hospitals a drop of 40% of burnout related turnover. So I'm very excited to speak to both of you. Thanks for having me.
Ayman, what is a micro habit?
Great question. So habit is something, a skill that you can learn through repetition. Now, micro habit simply is a term that we have introduced, which means a habit that doesn't take more than 30 seconds of your time in each of his repetition. So it's very affordable time-wise to do for someone who's already burned out and doesn't have the time to, for example, meditate for 5 minutes a day. But you could still manage your stress by practicing these micro habits for 30 seconds.
I've spoken to a few physicians who kind of say, this won't solve everything, the anti-yoga crowd. And I'm always like, well, I feel like it's a really dark world when we're attacking yoga, first of all, but it is a really stressful workforce.
Yeah.
And I don't know if everybody really understands that. So maybe you could talk about how that work happened. Like, how did you start doing that?
Great question. Now, of course, you're right, Janae, in saying that this is a big systemic issue, and really a stress management habit is more like a Tylenol for reducing the headache. We're not solving the root cause of the headache, that's burnout. So having said that, while there are other forces that are actually working towards fixing the root causes, it takes time. This is a big systemic issue to actually resolve those problems. In the meantime, why have our physicians, nurses, and basically any hospital staff suffer in silence while we're trying to fix the problem, systemic problem, for years? So what this does is gives them the tools that are easier to practice, especially given that, it doesn't become like a chore. Yoga, yes. And also the other thing I want to mention is, yes, yoga could be considered as, rooted in spiritual practices, and therefore maybe not so scientific, although there are some science behind why yoga works with the breath regulation and so on. What we try to do with the micro habits, and this is why it's targeted to frontline caregivers because it's science-based. What we try to do is it's actually not woo-woo or spiritual. It's mostly physical practices, such as take 3 deep belly breaths through the nose, into the belly, shoulders away, and then exhale and let it out. And do it 3 times. Easily doable in 30 seconds, and you could do it 3 times a day. It's not woo-woo, it's not spiritual, so you don't really have to believe in yoga or even meditation for that matter.
Earlier, you mentioned that you began this through workshops. Can you tell us a bit about the journey?
Yes. Of course. So we started off in 2019. I used to be on Wall Street, which Janae knows. And due to a personal trauma, I started meditating and practicing mindfulness for a long time now. So basically, I wanted to teach those simple tricks that once helped me to help others manage their stress. So I went back to school to become a social worker at NYU. And while I was going to school, I was also working with a brain lab where we were looking at children with ADHD and autism to see how mindfulness could help them. Now, while I was doing that work, one of my colleagues was at Mount Sinai, and she invited me to teach a group of medical students at Mount Sinai in New York mindfulness. And basically, I went in for 1 hour, taught them how to meditate. The room was overflowing, that people actually had to sit outside the doors on the floor. It went well, really well. People were interested. But a month later, when I followed up if they were feeling any better, the truth is the answer was no, because an hour of meditation with me for a month, through the month, it doesn't hold them up during the whole entire month. So once I walk out of that door, there is nothing to sustain that calmness. So they needed something that was quick, easy, and practical. And that's what the genesis of micro habits were. So I started doing workshops to teach micro habits. And that went really well. People loved it. Again, workshops were once a month. It didn't sustain because they needed reminders. So that led me to do a text-based, in addition to the workshop, text-based reminders twice a day of the micro habits every day. That was the magic solution. And one of the Cleveland Clinic hospitals that I work with saw a 40% reduction within 3 months of using Jivika of their attrition. So that, of course, was the perfect solution. Right now, because, text-based reminders are not always scalable, because I'd be texting and there's only one of me. So what we decided to do was take that and turn it into an app. So we'd still do the workshops to teach them the nuts and bolts and the science behind the micro habits, and the daily reminders will be apps. And the app doesn't only have reminders, it actually guides you through the micro habit, and it also gives you badges and rewards if you say practice more than 2 days a week. In addition to that,
I like
we
rewards.
also, what's that? The
I like
reward is rewards are always fun. And I was actually just on a call with our designer designing those rewards. Of course, think Peloton or, your iPhone's activity rewards. So it's more like, symbolic. Eventually, maybe we could do something that's a little more like, we have talked about it with some of the hospitals, doing once a month, end of month, whoever did the most practice gets a reward, which could be something like, an Amazon gift card or something of a recognition. People really don't need the monetary benefit. It's more about a recognition that you're doing a good job. It goes a long way. So those are some of the rewards. We also have the science behind each of the micro habits. We have about 200 plus micro habits that we're launching with. And for each micro habit, we put one paper as a reference that shows how it works. Why? Because, everyone wants to see the science, but we also understand that the particular population we're working with, the frontline caregivers, they need to see why they're doing what we're asking them to do.
Right. I do have a question, because a lot of
Yeah.
what we're hearing now, even as a nonprofit, is like pretty intense, like nurse strikes, like,
Yeah.
how do people find the balance between building a successful program and dealing with, unmitigated crisis, for example, or like you have to replace all your nurses, like these seem like bigger problems. And
Yeah.
sometimes when people talk about the solutions, I don't think everyone can make that connection.
Yeah. So the question is, how do you balance between a crisis and getting to a point where everyone is a little bit calmer?
Like, do they still work if people are like so mad, or is there like a a tipping point kind of.
Yeah.
Like, let's
That's
say
a
an
great
angry
question.
nurse is listening, you know, and they're like, what's happening here? You know,
Yeah.
what do you say to those people? Because I know you probably talk to people like that in your work.
Oh yeah. And I love one of the things that the workshops help us do is see, it's a pulse check to actually get feedback. So in person. So I'll give you an example of a crisis situation. So one of my clients, I'm not going to name them, invited me for the first workshop, and we started the text messaging soon in the first week. So at the end of the day, the person is supposed to text back how many times they did it, the micro habit. So it could be 0 through 3, or if you're super type A, it could be more than that. So one of them kept responding 0 for a couple of days. And then I get a message saying, how do you expect me to practice a stress management or breathing habit when I simply didn't have the time to drink water through the day? To tell you the truth. So, Maslow's hierarchy of needs, the basic need of this nurse was not being met, that of food and survival related fluids. So asking her to do something to manage her stress wouldn't work. So what I ended up doing was actually giving her more hands-on in-person feedback. So I would customize my micro habits for her. In particular was, did you drink water today?
Have you used
And
the restroom at all?
yeah, exactly. And you know what happened? She became such a big user, because every day she started taking these cute pictures of her pitcher of water. She started bringing a pitcher, and she would give me a picture before and after every day. And gradually she started doing the micro habits. So my answer to your question is, of course, when our survival needs are not being met, it's almost impossible or anger provoking to ask them to do something for their self-care. So, or like, something a little higher level in
Right.
the
Like,
Maslow's.
don't take a deep
So
breath when the house is on fire.
exactly. So what I would recommend for, a hospital where there are most of their nurses are on strike, to actually have a more, which I do, a personal messaging system. So it's
Right.
one-on-one, customized, at least initially. Let them develop the trust, and let them get the messages that are super customized for their needs. Let them vent sometimes. Of course, they don't vent saying, oh, I hate you or something like that, or I want to quit my job, or I want to do something bad to myself. It's more venting about, I'm super exhausted. I'm not sure if I can do this. And just to hear that's okay. It's okay for you to be exhausted, and it's okay for you to not do it. What made you exhausted? So things like that. So it starts the conversation. And if you could do that for 1 month, in my experience, it becomes easier to do the automated micro habits at that
Right.
point.
Once you get to the baseline.
Exactly. I mean, we're humans with needs, basic needs. If we feel heard, I think we all want to feel that way. And once we feel heard by someone, not anyone, but kind of anyone, and any particular one person, we start feeling like our needs are being met. And they are. And part of the reason why the strikes do happen is because we are feeling that our needs are not being met.
Right. Right. So you need to get there. So we're
Yeah.
almost out of time for today, but there will be a live session at 4 p.m. so people can join. Corrine, do you have any more questions for Ayman?
I think you hit on a theme that we've been talking about a lot with past awardees and nominees, but just to drive it home, what do you wish people knew about healthcare worker burnout?
I wish people knew how intense it is and that we're all humans. One of the things, two things that I would want to conclude with is a consistent theme that I initially learned, and I changed my messaging based on that and tailored my messaging based on that, is a lot of wellness programs start with the preface by almost intrinsically implying that healthcare burnout is a burden for the employees to carry. It's not. It's they're suffering from it as a result of things that are outside of their control. So that's the first thing. They're not responsible for the burnout. We have to be careful with the messaging for that. And the second thing is also what I heard after the pandemic, especially, and I don't use this term, the healthcare heroes or, superheroes or whatever we call them, is great because, we all went through a pandemic. We need superheroes. But the fact is, most people that I work with don't want to hear that they're heroes, because that's putting them in a position where they have to be infallible. And it's not possible for a human being to not have a down day. So don't put them in a position where they would feel like the expectations are so high that they're beyond a human possibility. They're doing a lot.
Yeah, that's a great thought. Like, we need to recognize that we're all human. And
Yeah.
thank you for your work.
Thank you so
And
much.
thank you for also just the energy you bring to this space. Like, I think it's really important.
Thank you, everyone.
Thank you so much.